I'm really lucky to have Eugene as an older brother. I think that he and I have sort of been partners in crime throughout our time growing up, and he has really been a role model for me. So basically...
Kevin is an outstanding individual who's probably too humble to say that he is one of the smartest people I know, and works very hard at everything that he does.
My father is a medical physicist and my mother is a pharmacist. And growing up, I think that they were just really quite fantastic at fostering curiosity. My dad might say something like, "Do you have any idea how water gets to the top of that really tall tree over there?" And I would say, "No." And so he would say, "Oh, this is how it happens." And I would think that was incredible and get really excited about it. I think that made me realize that there's just so much natural beauty and curiosity in the world, and that's really made me curious ever since I was a kid.
Johns Hopkins attracts the best and brightest students and residents in the world, and the Shenderovs are an example of that. The Shenderovs may be the only brothers, certainly the only brothers I'm aware of, that have won the Rhodes Scholarships. And in addition, they've been through so much to get here.
I was born in Ukraine, and we left when I was around 2.5, 3 to come to the US.
That was partly spurred on by being Jewish refugees from the former Soviet Union, Ukraine specifically, and partly by the fact that I had acute lymphocytic leukemia, which we think was as a result of Chernobyl.
I know that the experience of seeing my brother ill and spending so much time in the hospital with my family is something that definitely influenced my early childhood, and I think it's always made me very aware of how illness really can have such an enormous burden, not only just on the individual who's experiencing it, but on the whole family.
I think the added emphasis on research here at Hopkins was attractive to the Shenderovs. I think that they want to be great doctors, but they also want to be great doctors and scientists.
I aspire to become a physician scientist so that I can not only help the individual patients that I work with, but also develop better therapies and hopefully vaccines in the lab so that I can have an impact on public health and preventing the spread of disease.
Our Genes to Society curriculum is unique. That's the name of the curriculum for the medical school, and the name says it all. It goes from genes to society. That means that it tries to train people like the Shenderovs who emphasize research, but also are humanitarians and understand the importance of serving mankind.
A group of medical students and I started something called Charm City Clinic, which was, I would say, a branching of that desire to give back into the community with the skills we had at hand.
Working at Charm City Clinic has been an incredible opportunity to realize the amount of unmet need that there is in Baltimore in particular.
Hi, Kevin. What's going on?
I think that especially given my family's background and how we had to come to the US to seek medical care for my brother, I realize how important it is for people to have the opportunity to have access to health care.
It's a pleasure to meet you, definitely.
What draws me to medicine is the opportunity to help patients at their most vulnerable and be with them on their journey back towards health.
I promise to never give up on my patients.
I promise to reduce the burden of preventable diseases on people's lives.